All right, today we're going to dive into a classic pediatric puzzle, Hirschsprung's disease. Let's break down everything you, as a medical student, really need to know.
So, let's start with a classic clinical scenario. You're on your peds rotation, and you have a newborn who, after 2 full days, still hasn't passed their first stool, the meconium. What's the one diagnosis that should immediately pop into your head?
Well, that single sign is a huge pointer towards Hirschsprung's disease, which, when you get right down to it, is a type of intestinal obstruction that a baby is born with.
Okay, so what is it exactly? The other name for it is congenital aganglionic megacolon, and honestly, that name tells you pretty much the whole story. The key thing to understand is that this isn't a physical blockage, it's a functional one. It's all because a section of the bowel is missing the crucial nerve cells it needs to work properly.
So if there's nothing actually, stuck in there, what's happening on a cellular level to cause this massive backup? Let's get into the pathophysiology.
It all comes down to a problem during development. See, in a fetus, special nerve cells called neuroblasts are supposed to migrate all the way from the neural crest down to the very end of the intestine. But in Hirschsprung's, that journey gets cut short. So you're left with a segment of bowel that has no nerve ganglia. It's aganglionic. Without those nerves to tell it to relax and push things along, that segment just stays squeezed shut permanently. It's like a 4-lane highway suddenly hitting a section where all the lanes are closed. Total gridlock.
And that underlying problem, that permanently constricted piece of bowel, leads to a very specific set of signs. And the good news is, those signs give us a really clear roadmap for diagnosis.
So it all starts with that huge red flag we mentioned, the newborn not passing meconium in those first 48 hours. From there, you'll start to see other classic signs of an obstruction. The belly gets big and bloated, the baby might start vomiting, and they'll seem really uncomfortable and colicky.
Once you see those signs, it's time to start the workup. You might start with a simple digital rectal exam, but then you're probably going to move on to imaging. A barium-assisted X-ray is really useful because it can actually show you that narrow, constricted segment and the hugely dilated, backed-up bowel right behind it. It's a pretty dramatic picture.
Now, imaging is a great clue, but it's not quite enough to be 100% sure. So how do we get that definitive, rock-solid proof? And this right here is the answer. This is your gold standard, a rectal suction biopsy. And what's so fascinating is that we're not just looking for something that's missing, the ganglion cells, we're also looking for something that's there in overdrive. Because those ganglia are absent, the remaining nerves get overstimulated, and they start pumping out way too much acetylcholinesterase. That's the dark brown stain you see here, and it's the smoking gun that confirms the diagnosis.
Okay, so you've confirmed the diagnosis, now what? What's the path forward? Let's talk about the treatment and the potential bumps in the road. The treatment is surgery, plain and simple. The surgeon has to go in and remove that whole non-functional aganglionic section of the bowel. Then, they perform what's called a pull-through procedure, where they bring the healthy, working intestine down and connect it to the anus.
But the story doesn't end after surgery. You have to be incredibly vigilant about potential complications. The most dangerous one is Hirschsprung-associated enterocolitis, a really severe inflammation that can be life-threatening. And even beyond that, you have to watch for more chronic problems like malnutrition, bowel perforation, or even just persistent constipation.
And I'll leave you with one final, really important clinical pearl to tuck away. While Hirschsprung's can happen all by itself, it's very often associated with other genetic syndromes, like Down syndrome, or with specific gene mutations. So a diagnosis of Hirschsprung's should always make you wonder, is there a bigger picture here? That's something to really think about.